What is diabetes? Diabetes is a disorder of the pancreas, an organ in your body that controls the amount of sugar in your blood. When you eat food, your body breaks down the food into sugar, fats, and protein that your cells use to keep your body working. A healthy pancreas helps to bring your sugar levels down to a normal level over time by making insulin. Insulin removes sugar from the blood and moves it into the cells. Without insulin, your cells can't use the sugar that you get from the food you eat to use as energy. Think of insulin like a key. When insulin is in the blood, it unlocks the door into the cell and allows glucose to enter the cell. However, there are a number of reasons why the pancreas may not work the way it should, or your body may become resistant to the insulin that used to work to keep your blood sugar in control. This will lead to higher levels of blood sugar, also known as hyperglycemia, which can lead to a number of health problems over time if not corrected. Going back to the key example, it may be the case that the locks on the cells are changing, and the insulin key cannot open the cells like it used to. While we're not exactly sure what causes type 2 diabetes, we do know that there are two main factors to consider: genetics and lifestyle. Patients with a family history of diabetes have a much higher chance of getting diabetes themselves, so it's important to tell your provider if someone related to you has diabetes. Patients who are higher than healthy weight, who do not exercise often, and who eat high-carb diets are also at higher risk of getting diabetes as well. If you have too much sugar in your body, your pancreas has to work harder to keep your blood sugar under control. After a long time of working and having to deal with an unhealthy diet, the pancreas starts to weaken and cannot make as much insulin, leading to diabetes. We want to reinforce that just because there is a link between higher weight and diabetes, not all patients with diabetes are higher than healthy weight. As we mentioned, there are several reasons for the development of diabetes, and weight and diet are only a few factors involved. However, it is generally recommended that lifestyle changes that help to improve weight and diet are started early on to help control diabetes. Over time, high blood sugar can cause lots of issues in your body, if not corrected. Your eyes and kidneys can be affected, and diabetes can also affect the nerves in your hands and feet over the years, so that you have less feeling in your limbs. If this gets bad enough, you may not notice bad wounds on your feet, since you can't feel them as well, which can get infected and require more intensive treatment. It's important to keep your blood sugar levels from getting too high, so that these issues can be prevented. Over time, diabetes may also increase your risk of high blood pressure, which can increase your risk for heart problems. So what can you do to reduce the chances of you getting diabetes? Unfortunately, you can't change your genetics, but you can change your lifestyle. You can consider getting in some light exercise, such as walking around the block, or jogging, or riding a bike. You can start by exercising once a week, then move to 2 days a week, and so on. Ideally, a patient would be exercising for 30 minutes a day, 5 times a week. You can also improve your diet by eliminating high-carb foods like I mentioned before, and try some of these other foods instead. Fish, fruits and vegetables, nuts, low-fat meats and yogurt, cheese, and eggs. If you like drinking soda, also consider switching to diet soda, since regular sodas have a lot of empty calories and sugar. All of these changes should also help you to lower your weight, which is the best tool you have to lower the amount of work your pancreas has to do to keep your blood sugar stable. If you are diagnosed with diabetes, the provider will usually start you on a drug called metformin, which helps insulin work a little better and makes it easier for your cells to get sugar from the blood. They may also tell you to expect some side effects like nausea, vomiting, diarrhea, or gassiness. If you experience these symptoms or anything else that feels unusual, please let your provider know at your next appointment. Your provider will also want to keep an eye on some of your labs, including your blood sugar, fat levels, and how your affected organs are doing. They will probably schedule an eye and foot exam for you as well, which should happen once a year for diabetic patients. In the office, blood sugars will be measured every 3 months using what's called an A1C, which shows us if your sugar levels are too high over a longer period of time. A higher A1C is linked to some of the issues we talked about earlier. Diabetic patients are encouraged to keep their A1C level below 7%, and your provider may make a decision on how your medications need to be changed if your A1C gets too high. One way to make it easier for the provider to tell how your medication is doing is to check your blood sugar at home. You should have a journal with you that you can fill out with the following information each time you check your sugar: the date, the time of day, your blood sugar level, and any notes like how you are feeling or if anything feels different about your body when you take your sugar levels. When you do check your sugar, try to make sure that it's around the same time each day. Talk to a provider here at the ICC if you need testing strips or a journal to track your blood sugar. Diabetes is a disease that will need to be monitored closely by your provider and requires you to be consistent with your medications. However, it is a manageable disease that can be kept under control by keeping track of your weight, diet, and exercise levels. Make sure that you are taking your metformin and other medications according to your provider's instructions. We hope that you bring any questions you have with you to your next appointment at the ICC. Until next time, stay healthy and stay informed.